Welcome to 10th or Tuesday. This is episode number 27. My name is Michael Boldin. I'm joined by
Michael Maharrey.
And Mike, today is day 397 that the GOP has failed to get rid of Obamacare. This is going to be a broken record after, well, it won't be because the numbers are going to keep going up.
Yeah, numbers are always different.
But we want to talk a little bit about something else that we've been working on, we've talked about on the show, to deal with Obamacare and health care freedom in a little bit. But I want to get right into some bill reports that you've been covering. First of all, on asset forfeiture. This is something that we haven't talked about in a little while. Asset forfeiture, the process where they take your property. In essence, they charge your property with a crime, and then you have to prove that the property wasn't used in this so-called crime in order to get it back. It's government stealing. And a really good bill has been filed in Rhode Island to deal with not only the state asset forfeiture program, but the federal equitable sharing program. Give us a quick overview of those two things, Mike.
Yeah, this Rhode Island bill could actually be a piece of model legislation. It's one of the more solid asset forfeiture bills we've come to see. So first off, it deals with state-level asset forfeiture and significantly reforms their laws there in Rhode Island. It would require a conviction in every situation. So they would completely do away with civil asset forfeiture, which is the process that you just talked about, where they effectively charge your property with a crime.
Wait, it totally gets rid of it? So it's 100% needs a conviction in all cases on the state level before there's any forfeiture? That's House Bill 7640, H7640, which was just introduced in Rhode Island. That's awesome. Okay, so state level, that's really good.
Yeah, really good. So what we've seen, though, oftentimes with these state-level bills is the state will reform their asset forfeiture laws. They'll make it more difficult for police to take your stuff, and the police will circumvent that using the equitable sharing loophole. And basically how this works is they just pass the case off to the federal government. They let the federal government prosecute it. And then the federal government gives them up to 80% of the proceeds back. And this bill in Rhode Island completely closes, well, it doesn't completely close the loophole, but effectively closes the loophole. They would not be able to allow any type of this passing off. They call it adoption. This would not be allowed unless there's cash over $100,000. So,
yeah, and some of the research that we saw, for example, we saw some research by the counties, I think, in Colorado that said this was like 85% of the time.
Most of the time.
So that's very, very good.
Not only that, anytime they do get equitable sharing money in those very rare instances, that equitable sharing money would have to go into the general fund after reimbursing police departments for their investigative costs. So it really completely takes away the policing for profit aspect of asset forfeiture, where cops basically do this in order to fund their budgets.
Yeah, that's excellent. Okay, so House Bill 7640 in Rhode Island. Another bill that's moving forward in Washington State from Representative Matt Shea, good friend of the 10th Amendment Center, is House Bill 2718. Isn't as comprehensive, but he's been working on asset forfeiture, him and Dave Taylor and a number of other people, I think Goodman, maybe a few guys that are working on this in Washington State, and it keeps getting shut down. It won't get a hearing, or it gets voted down, or it gets opposed at every level when they try to be as comprehensive. So Shea and a few others took a kind of a strategic approach in Washington State to get the ball rolling. Tell us a little about what's going on in Washington State. It passed the State House, House Bill 2718.
Yes. So this bill actually is way less comprehensive in the reforms on the state level. It still would not require conviction, but it does up the level of proof that's necessary and provides various other protections for individuals. So it makes the process at least better. There's more of a semblance of due process in the process that they've put into this bill. But I think the significant thing is that it also creates a foundation, at least, to deal with the federal loophole. And that's in the form of reporting requirements. And that may not seem like a big deal, oh, what's the big deal with reporting requirements? But when people start to see what's going on, and this includes legislators, I think a lot of times even the legislators don't know what's going on. So when you get solid...
I think most of the time legislators don't know what's going on. I mean, they all went to government schools or government-approved schools like most of us, so a lot of them haven't unlearned the learning they got, so they're just statists. So, of course, their instinct is that, okay, everything's fine. Police are here to protect us at all times, and government is good, and all our foreign policy is amazing. But anyway, that's different episode.
So when you get these reporting requirements, that opens the door to further action down the road because it shines a light. You know, they say sunlight's the great disinfectant. Roaches don't like sunlight. So I think this is a good first step, especially considering, like you mentioned, the political dynamics in Washington state. They're not going to get a comprehensive bill passed. And I think this is a really good first step. And you know, talking to Matt, that's definitely how he's looking at it. He's not looking at this as the end game. He's looking at this as the first building block in what will hopefully become comprehensive asset forfeiture reform there in the future.
Tell me a little bit about the reporting regarding the federal equitable sharing. Is it basically saying every time they, so right now, as it stands from how I view it, is that every time they do one of these federal sharing jobs, let's say they pull somebody over, or they take a bunch of cash, whatever it may be, property, they take someone's car, and then they're like, well, we want to get around the state law, so we're going to say, hey, federal DEA, we think this is your case now. So they pass it off, and then it's adopted, an adoption by the federal government. So as it stands right now, if that happens, no one knows that it happens. There's no database, no nothing, no information on how often it's happening, how much. So from my understanding, Shay's bill is basically saying every time this happens, they have to document it. We're going to have a repository of information. And then I have a feeling, and the way I know how Matt works, he's going to basically go out there and start hammering on this in a couple of years, saying, look how many times they're doing this. You know, they're getting around the state law by going to the feds. And that's the foundational step. Is that a good summary?
I think it's a real good summary. And there is some reporting on equitable sharing, but it's all at the federal level, and it's all aggregate. So you can look and see that a given department got so much money in equitable sharing, or a county, or you know, an agency, but it doesn't break it down. And this reporting requirement that's in this Washington bill would break it down per incident. So every single one, it would have to be, you know, what were the circumstances surrounding it? How much money was involved? Why was it sent to the federal government for adoption? What was the basis? So it would be a very robust database, as opposed to just looking and saying, oh, you know, X county got $40,000 from the federal government. We would be able to look at it and say exactly how this came about and what the circumstances are. And we know that so many times these circumstances are shady. People are abused. You know, it's some poor guy that was driving through the state. He had $3,000 in cash because he was going to buy a used car.
Target on your back, yeah.
Yeah, exactly.
You know, I wonder if that's basically what happened in Colorado. We should at some point look, maybe in between legislative sessions, we should look and see, because we've got a lot of detailed information, some reporting from Colorado. We didn't do ourselves. We just found, you know, the counties, or there was reporting on how often this is happening. That's why we know that it's somewhere like 80-85% of the time adoptions are under $100,000, because the counties are reporting on this. And that made it easy to get the next level passed last year, because people could go and say, look, this is what's going on. This is how often it's happening. That's why at this limit, it's going to help most of the time. Right. So information is power oftentimes. And so maybe that's what happened in Colorado, and it's not happening in Washington state. So this is really good. It passed the House by 95-3 vote in Washington state. Good job, Matt Shea. It was also Roger Goodman, so a Democrat and a Republican doing that, co-sponsoring that bill. And it's scheduled for a committee hearing and possible vote again this morning on the Senate side to get it to the Senate floor. So that we'll be watching and reporting on. One other asset forfeiture bill that you covered, Mike, was in Virginia. And this one, I don't want to be the negative nanny here. I mean, so I like to look at everything on where can we find the positive. So I think there is some positive on this, but if we aren't wary of what isn't positive, and people, you know, go home thinking like, okay, Virginia did a great job on this, there's going to be a real problem in the next few years. Tell us about what's happening. And this one passed by a wide margin, if not unanimous, in the Virginia House too, I think.
So this is a solid bill on the state level. Not quite to the extent of Rhode Island, but in most cases it will require conviction for asset forfeiture to proceed at the state level. But the problem here, the big negative, is that it leaves the loophole completely open and allows, without really any oversight, any accountability, any limits, the state and local law enforcement to pass these cases off to the federal government. So what's would likely happen, and we've seen this, I'm not just making this up, this is exactly what happened in California. California passed some of the strictest state asset forfeiture laws in the country, and then you look at the statistics, and all of a sudden you see the equitable sharing go way, way up to the point that it was actually one of the worst states in the country.
I think it was at the bottom or the top, depending on how you look at it.
Depending on how you look at it.
So, yeah, California was as bad as they get. Right. But then again, California ended up closing that loophole in 80 to 90% of the situations in a following legislative session. So it really, on these types of bills, what's happened, it's House Bill 900. It passed by a vote of 81 to 18 in Virginia. So on these, it's well, let's see what happens. I don't like the whole Ronald Reagan thing of trust but verify because, look, I prefer the Thomas Jefferson method, and we did a video on this recently, which is don't ever trust them. And then if they do the right thing, then that's great. Reagan took the wrong approach on that, saying, okay, trust them. No, you shouldn't trust politicians. And passing this could be good. And in fact, stopping things on a state level could be good. But unfortunately, the way it plays out is that it actually doesn't have any concrete effect until you close that federal loophole, because we know that law enforcement will they still need the cash. Because their budgets are too big, because they're doing too much stuff. They're enforcing all kinds of laws that they shouldn't be enforcing, that shouldn't exist. So they need massive budgets. And the way they get a lot of this is through billions of dollars of asset forfeiture cash. So we need to shut this down as quickly as possible in every state possible. So we'll see what happens in Virginia. It would be good if they do a follow-up on this, but if there's no talk of a follow-up, then there's a real problem. We'll see. We'll kind of see what happens. It's essential. So House Bill 900, we will continue to monitor that bill to just make sure that that foundational first step happens, or if it doesn't, we'll make sure that you know about that as well. Now back to health care. We've been talking about Obamacare for quite a long time here. Some people even think that that's where we got our start back in 2010, but certainly we were founded back in 2006, pre-Obamacare. But even before the Affordable Care Act went into effect, Mike, there was way too much government control over the healthcare industry. This is an over-regulated. Health insurance is so regulated that it's hard to actually do anything. That's why the direct primary care model is something we've been supporting for quite a while now. So tell us a little bit what's going on. You just signed up. You told me yesterday that you have, and you've talked about it on the show here, but you have your first direct primary care appointment. Give us a quick rundown of what this model is. Yeah,
so I do have a doctor's appointment tomorrow with my.
Not to be too personal, I'm sorry.
No, I'm not gonna tell everybody, what's gonna get checked or anything. But no, I'm really excited about this because
it's a mental health check. It's okay.
And everybody knows that is a definitely.
No, it's okay. I mean, I still care about you a great deal.
It's okay. Anyway, so in all seriousness, Kentucky passed one of these direct primary care bills last year, and what the bill effectively does is it mandates that you cannot treat a direct primary care agreement as insurance. So it frees it from all of the regulatory bureaucracy that comes with the state insurance department. And so what is direct primary care? So the way mine works, $75 a month. I have unlimited appointments with my my primary care physician. And basically, for that price, they do whatever a doctor would normally do in the office. So if I get strep or, get the flu or whatever, sprain my ankle, I'll go to the doctor's office. All of that is covered for my $75 a month. On top of that, they also get tremendous savings on lab work, on medication. They have their own pharmacy in the office, so I don't have to go to Walmart. So everything has tremendous cost savings. Now, this is what they told us we were going to get with Obamacare, right? But what I ended up with Obamacare was health insurance that was running me $1,000 a month that didn't cover anything and had a $6,000 deductible. So not real cost effective. So I'm going to now have the opportunity to take care of my basic medical care at a very reasonable, affordable price. And, then I can worry about my catastrophic insurance at another level.
Are you able to get catastrophic insurance separately or?
Well, no. Okay. There are options. There are options such as religious health shares, which actually
I've never, as an adult, I've never had health insurance. So this is and I just didn't get any after the whole Obamacare mandate came in. I guess I guess the IRS is going to have to fine me over time on that. But yeah, no, I never got it.
Fine this year, because that was one thing they actually did in the tax plan, was get rid of the
Does it do anything retroactively? Because I don't know.
I
know the IRS, by the written letter of the law in the ACA, they can't actually use any of their tools to collect. So people who don't pay the Obamacare mandate from previous years, they will continue. I'm sure there will be a ledger on me saying that I'm continuing to have penalties added up, and eventually I'm sure they're going to want to try to collect that. So it's dangerous, it's messy, but I never got that insurance. And first of all, I don't like most insurance plans because I don't want to pay for a bunch of stuff that I'll never use. It's socialism at its finest. It's not really healthcare, and most insurance programs, especially the government-controlled ones, they don't like the type of healthcare that I have. I prefer, I'm friends with Robert Scott Bell. I like health freedom. I like natural paths, things like that. None of this stuff is ever covered. So why would I pay for a bunch of crap that I'm never going to use? I would like a catastrophic plan, but here in California, I'm sure just like you, this is very difficult, if not impossible, to have happen.
And this is, and this is the absurdity of Obamacare. Here you have a federal mandate that basically keeps us from having the type of choice that we want. And I'm sure that I'm sure we're not alone in our desire to have something that's affordable, but you're put in a position where you either have to. I noticed that there was a bill filed in Virginia that they're trying to allow their insurance companies to create these catastrophic plans, but they have to get a waiver from the federal government. So basically,
Virginia's, when you're right next to Rome, you're always going to do what Rome likes. Virginia is one of the weakest. It comes to rejecting federal power. Maryland, New Jersey, North Carolina, they're all really bad. Not to say that California is great, but the states that tend to reject federal power tend to be furthest from Washington, D.C. It's just what happens.
We talked about this a couple episodes back in Idaho, where their state insurance commissioners basically given the green light to insurance companies to write whatever kind of policies they want to within state guidelines, and basically a big middle finger to the federal government. So
we should actually, before we started the show, you and I were talking about how you've been doing some interviews for, you started doing video interviews for Shift Gold just last week. Is that right? And I want to do some here where we're interviewing some experts. And I think on this issue, we should talk to, from Cato Institute, Michael Cannon, because I've been seeing some bills, because I don't really necessarily understand how they all work out in practice. So this is an issue that it's just something that I haven't personally looked into real deeply. So I saw a bill in New Hampshire that's under consideration in the House that would allow out-of-state insurance companies to provide services in New Hampshire. And I think crossing state lines, that's one of the things. Preventing people from crossing state lines and buying products out of state is part of what keeps the market from actually being a marketplace, and it becomes government control. It's kind of like when you only had one telephone provider. The service was bad, the quality was bad, and the prices were high. And as you have more competition, it becomes better. So I think more competition, that's why I like the direct primary care model. You have lower prices because you have less of the regulatory burden under the insurance scheme, the government-controlled insurance scheme. And then you get better quality, right? I mean, you're going to find out with your doctor firsthand. You should start documenting how well this goes.
I'll tell you what, I mean, just from my initial experience, I signed up and I did everything online. And then within about 30 minutes, I had an email saying, hey, welcome to this practice. You'll be getting a phone call within the next 24 hours to set up your initial appointment. Appreciate you, within the next morning, I got a phone call from the office. Hey, when you want to have your appointment, they had, full range. I could have had an appointment actually last week, and it just didn't work.
Man, try going to a regular doctor for the first time, and you're going to wait like months.
So I'm impressed with the level of service. And for people who wonder whether these direct primary care bills actually work, like I said, this passed in Kentucky last year. Prior to this bill passing, there was one direct primary care provider in the state of Kentucky. And now here we are, less than a year later, there's actually two in the city of Lexington that have opened up this practice. So I'm sure it's going to grow because who doesn't want to save money? And the doctors love it because it gets them out from under all this insurance garbage.
Yeah, they're spending so much time on paperwork. Here in California, we have a kind of a broad telemedicine. So on certain things, you can't do like a monthly retainer plan where you get everything covered of a certain range of things. But for some minor things, like you have the flu or something like that, a lot of times you can be seen by a doctor through the internet. They have apps. Right. Lemonade Health is one of them. You basically, there's a limited number of things, and the cost tends to be pretty cheap. I don't have really a lot of experience with it, but I think that's another way of kind of breaking through the traditional system, waiting in offices, going to emergency rooms because you can't get an appointment. It's really, the whole health system is a mess. And for me, the mess is there because it is one of the most, if not the most regulated industries in the country or on the planet, really. Between that, it's guns and money, health, guns and money, all these important things are super regulated, and they're definitely not in a good place.
It's effectively a monopoly.
Yeah.
And like you were just saying, monopolies are bad, generally speaking, for consumers.
Well, the only real monopoly, as you know, is one that's enforced by government. One that just happens naturally out of consumer choice isn't truly a monopoly because it requires the force of the gun to prevent competition. So when a bad business actor, as we both know, we've both read Mises and Rothbard to some degree, right? Although I have a little trouble with Man, Economy, and State. That's a little, I can't get through that book.
It's a little dry.
Well, yeah, it's a tough one. But we've both learned, and I think many others have learned, that when a business becomes kind of like a, quote, monopoly because it's the only actor in the marketplace, if it's making a ton of money and provides bad service and there is no government to block out competition, then people will start providing the same service for a better price or better service for a better price. And then there will be competition. So, but back to direct primary care, the more states are looking at legislation like this. So in South Carolina, House Bill 4643 just passed the state house. Is that right?
It did, and it was it unanimous? I can't remember. I know it was a huge vote.
Yeah, it was unanimous. I think it was 100-0.
Which kind of is surprising in South Carolina because it's a very contentious legislature. So to get that kind of agreement on something, it's pretty impressive.
And we've seen there's a couple of bills like this, and people think like anything that we support, especially like on health freedom, has got to be from a Republican. But no, I mean, you see unanimous support on these, or a lot of bipartisanship, which is usually dangerous. But a couple of bills, good direct primary care bills that would allow this kind of service in Maryland were both filed by Democrats. So Democrat, Republican, I think is...
Are there Republicans in Maryland? I'm not even sure that there are.
Well...
There are not very many.
I mean, those letters have very little meaning a lot of times.
Well, and there you go. That's the reality. And you see that more and more as you really get involved in the legislative process. You really start to see that distinction fade away.
Yeah, I want to talk about one of these days about what goes on in places like Arizona. So when Obama was in office, you had tons of bills filed that talked about the sovereignty of the state. The federal government can't do this. They can't, they can't rely on resources from the state, on guns, on surveillance. But then as soon as the Republicans get in charge in Washington, D.C., then none of those bills are filed anymore. They just disappear completely. And the only ones filing them are now Democrats. They file them on marijuana. We're not going to allow state resources to help the federal government enforce prohibition in the state because they have medical marijuana there in Arizona, so they're not going to help enforce laws against their own medical marijuana patients. But because the Republicans are in charge and they see it as a Democrat bill, they don't even let them get a hearing. So partisanship is garbage. It's really disgusting. It's very dangerous. That's why we always hold to principle and will report on things, whether they're good or bad. Doesn't matter who does it. So unanimous vote on House Bill 4643 to get a direct primary care system set up there in the state, which would be great. Basically, the state takes a hands-off approach, which is fantastic. Also, a similar bill, we have a report from T.J. Martinell, the Senate Bill 1311 in Idaho. So Idaho, that'd be really interesting to see if they start offering programs or insurance plans that are not authorized by Obamacare. And then on top of it, also say that direct primary care plans are not insurance, so people can just start getting involved in that. That would be a really good thing happening in Idaho if we can see that pass.
This is actually a different bill.
Is it?
Yes, it is. I didn't realize it until I started looking at TJ's report and then going back and reading the bill. They actually already have direct primary care in Idaho. They passed it in, I think, 2015. So they're
Oh,
one of the
okay.
early states. So this bill actually, and so we can talk about this a little bit because we kind of touched on this the other day, because I see this as it could be good, could be bad. But what this would actually do is it creates a pilot program to allow direct primary care access to people in their public health system. So the state would pay up to $75 of the enrollment of the monthly retainer fee, and allow folks in these pilot programs to access that direct primary care. And I read the bill real carefully because I was looking to see, okay, are there any regulations on the direct primary care provider? And there's not any at all. Basically what it is that we're going to make this available and we're going to pay through our health system. So they're trying to cash in on these cost savings is what they're trying to do.
Is it basically saying that if you're already getting some kind of government cash out, assistance, whatever they call it, you can now use it? Previously, you couldn't use it for a direct primary care plan?
Exactly.
Yeah, I have mixed emotions on that, and I'm sure you do too. It's hard to say. I mean, I guess we'd have to ask Walter Block on whether that's a good thing or a bad thing. But I guess when I tend to have a gut instinct that when government money is on the table, get as much back as you can. Use it in the most cost-effective way as you would as if you didn't get it from government, because they stole it from people in the first place. So that's one way to look at it. Other people would, I think, disagree with me on that, and maybe I could disagree with myself as well, where they say the more you use the government funds, the more you put it back into the system, the more that you're showing a market desire for it, and therefore you're kind of helping entrench the whole thing. I don't know which way is right, to be honest with you.
And from a pragmatic standpoint, I like the fact that these folks are recognizing the value of direct primary care. I appreciate the fact that they see the cost savings. And this bill in and of itself is, I would say it's a good bill from that standpoint. But what makes me nervous is when you start getting government money, how long is it until the state comes behind and says, oh, you guys are taking this public money, so now we're going to regulate direct primary care. So, that's the double-edged sword. And my gut instinct is over the long haul, it probably is going to be bad news for direct primary care folks that get into this program, because somebody's going to come along and say, oh, well, they didn't do this, or, oh, they're, and so that's the part that makes me nervous about it. I just think
why is your direct primary care plan not covering this? It's only covering ankle injuries and the flu and colds and things like that. But now you need to cover maternity issues. You can't tailor the program. So, okay, we'll keep an eye on these things. There was another.
So I think it'll be interesting to watch. But I think the positive that I take away from it, and big picture, it's what we've seen in so many other issues. Once something gets established where you can create a market, that market tends to expand. And this is an expansion of direct primary care market. Now, it's expansion by government, so maybe that's not good. But it does prove that opening the door tends to allow the door to open wider down the road.
I think it's a learning experience. So people who are getting the government money for health programs in Idaho or elsewhere, they're going to get an opportunity to experience something more market-based, even though the cash that they're using to pay for it. So, like, the service is going to be market-based, and they'll clearly learn that instead of going to the DMV for healthcare, they're going to be like, oh, wow, I'm getting an email response from a doctor and get online appointments the next day, things like that. And I think the learn
at the doctor's office for 2/3 of the price of the pharmacy.
Yeah.
So
I think the learning experience that market solutions are better is good. And the more people that do this and get involved in this type of thing, the better, the harder it is for government to control. Roger Ver, who was the first cryptocurrency investor, angel investor, they called him Bitcoin Jesus for many years. I don't think the guy really likes that phrase, but he's basically been proselytizing the use of cryptocurrency. He basically says the reason he likes it, and this is an anti-war, anti-state, he's a anarcho-capitalist. He is totally anti-government, total voluntarist in basically every situation. But his view on using crypto is kind of the same concept. He wants to get more and more people to start using it, so that it becomes so ubiquitous in society. The more people that use it, the harder it will be for government to come in and just put regulations and control on it. He wants, while it's unregulated, get everyone exchanging it and using it for goods and services. And that, of course, is my segue to the next bill that you reported on in Wyoming. A bill in the state Senate, I believe, that would, it's basically taking the same approach that we've reported on in regards to some states on sound money, gold and silver, taking a hands-off approach on taxation on cryptocurrency. And the way that you reported, I think, on it was really good on the effect. By taking taxes, property taxes off of it, on the state level, then people are going to be less concerned about exchanging it. Then they'll be more likely to use it. The more likely they are to use it, the less likely that the Federal Reserve will be able to continue its monetary monopoly. Is that a good summary?
Exactly. That's a beautiful, perfect summary. And it was interesting as I was, whenever we get a new type of legislation like this, you kind of have to think through, okay, how do we want to approach this? What's the message here? What's the big picture benefit of something like this? And it was interesting because it really dovetails almost seamlessly with our existing messaging on gold and silver, because in the big picture, it's going to do essentially the same thing. It just creates another currency alternative. And that's all this crypto is. It's a medium of exchange. It creates another option besides Federal Reserve notes that people can exchange value with each other. And so the more of that exists, it's just like we were talking about with healthcare. We have a bigger market. We have more options. The better options are going to rise to the top. The worse options are going to end up being pushed off to the side. And we all know that the worst option in all of these is the Federal Reserve note. So it's just another piece of the puzzle to create competition for money to break that Federal Reserve monopoly. So
yeah, and
the talking points are real similar to what we talked about with gold and silver already.
One thing that I look at on this, and I know there's some debate, at least in our community and from people that we follow and support, and our own supporters, some people say crypto is fiat, crypto's junk, it doesn't restore its value. And whether that's the case or not, and of course gold and silver is not fiat, it does store its value over thousands of years. We know this. We are 100% behind gold and silver as currency, and following Article 1, Section 10 of the Constitution on money, of course, 100%. But if people want to make an exchange, whether it's a cryptocurrency, whether it's BCH, Bitcoin Cash, or Zcash, or anything else, if they want to exchange, if someone has a business that wants to sell, I don't know, a camera, and they want 1.04 BCH in return for it, what we want is the government outside of that. We don't want the government to tell those people that they can't do it or adding a bunch of taxes on the exchange to discourage it. And we know why the government does that is because they want everyone using their fiat, which is how they can control, debase the currency. They can easily inflate it. As long as it's controlled by them, then they can get away with all the stuff that they do. And that's why I believe in supporting whatever. If someone is using onions as an exchange, I don't care what they're doing, we're going to get behind supporting them if it's happening in large numbers. And this is a $400 to $500 billion market cap on these cryptos. So this is very large. And the more that people do this, the more that people are using stuff outside the fiat system, the better. And then, of course, at the same time, we continue to support these efforts, for example, in Utah, in Texas, and elsewhere, where people can start doing electronic transactions in gold and silver.
Absolutely. And I don't know that I can really add a whole lot to what you just said, because that's it exactly. And I think the Federal Reserve, it's the head of the monster, because with the Federal Reserve controlling the currency, with it basically being in bed with the government, effectively being part of the government. I know there's people, no, it's a private bank, but really,
well, I think that comes from the people. I think there's two groups of anti-central bank people. There are the anti-central bank people like you and I, who don't like the idea of government monopolies by force, violations of the Constitution, attacks on liberty. And then there's the anti-big business, if it's run by a company, then it's bad. So the latter looks at the Federal Reserve as a private bank, and then it would be okay if it was run by the government. And that's nonsense. Whether it's private or public, it doesn't matter. And really, when you get down to it, if a private industry, for example, like banking, which is so controlled by the government, it makes no difference whether it's owned by private actors or not, if their actions are dictated by government regulations or rules or laws. In essence, they are just privately owned government agents. They are acting on behalf of government desires. Exactly. So it doesn't matter who owns it, really. It matters how its rules are dictated.
And the bottom line is, if you didn't have the Federal Reserve creating money and manipulating the value of currency, you wouldn't have the wars, you wouldn't have the incredible increasing size of government, because it simply couldn't pay for it. Yeah. All of this is paid for through inflation and through central banking. And you get rid of that, so much of what we're dealing with in terms of overreach and unconstitutional expansion of government, all of that is fed effectively by the Federal Reserve.
Yeah, so the war on privacy, the war on other countries, the war on other populations, the war on drugs, the war on your right to self-defense, your war on health freedom, this is all funded by fiat, and it's not good stuff, right, Mike?
Amen. So go Bitcoin and gold and silver.
Well, really all of it. So I'm not sure what we're going to cover next week, but I think we've got it. Basically, we've covered all ends of what we planned on talking about here today. This is episode 27. Of course, if you support our work, 10thamendmentcenter.com/members. We have got membership programs starting from monthly at $2 a month to yearly, 5-year, lifetime, just whatever you can afford. We need your support to continue doing the work that we're doing, to expand it, to reach new people, and to have more effect. In the last few years, we've seen more nullification bills introduced and passed than at any time in our history, and we're going to keep ramping that up. Of course, thank you so much for watching. We will see you next time here at 10th or Tuesday.